Assalamu alaikum. I am Rita Amjad from BS Biotechnology and my presentation topic is benzodiazepine. Introduction to benzodiazepines. Benzodiazepines are a class of psychoactive drugs that are primarily used to treat anxiety, insomnia, and muscle spasms. They are among the most commonly prescribed medications worldwide due to their effectiveness in managing various conditions. Benzodiazepines work by enhancing the effects of a neurotransmitter in the brain called gamma aminobutyric acid GABA. GABA acts as an inhibitory neurotransmitter, which means it helps to calm down excessive brain activity. Benzodiazepines are a class of psychoactive drugs that act on the central nervous system CNS to produce a range of effects, including an anxiolysis, reduction of anxiety, sedation, muscle relaxation. They are commonly used to treat a variety of conditions, including anxiety disorders, insomnia, and muscle spasms. History of benzodiazepine. The history of benzodiazepine dates back on the mid 20th century, which researchers were exploring new chemical compounds with potential therapeutic properties. Here are the key milestones in the development and history of benzodiazepine. Introduction of diazepam. In 1963, Dr. Sternberg and his team developed another benzodiazepine called diazepam, which are marketed as William diazepam, quickly gained popularity and became one of the most widely prescribed medication in the world during the 1970s. While clinical use and concerns, benzodiazepine became widely prescribed in the following decades due to their effectiveness in managing anxiety, insomnia, and other conditions. However, concerns about the potential for dependence, tolerance and withdrawal emerged over time. Classification of benzodiazepine. Benzodiazepine are a class of psychoactive drugs that possess sedative, hypnotics, anxiolytics, anti-anxiety, and muscle relaxant properties. They are primarily used to treat conditions such as anxiety disorders, insomnia, and alcohol withdrawal symptoms. Benzodiazepine can be classified based on their pharmacological properties, duration of action, and clinical uses. Here are some common classification of benzodiazepine. Short-acting benzodiazepine. These drugs have a rapid onset of action and a short duration of effects. They are commonly used to treat insomnia and acute anxiety. Intermediate acting benzodiazepines. These drugs have a moderate onset of action and duration of effects. They are often prescribed for generalized anxiety disorder and muscle relaxation. Long acting benzodiazepines. These medications have a slow onset of action and a long duration of effects. They are typically prescribed for the treatment of chronic anxiety. Examples include diazepam, clonazepam, and flurazepam. Chemical structure of benzodiazepine. Benzodiazepine are a class of psychoactive drugs that are commonly used as sedative, anxiolytics, anti-anxiety medications, and muscle relaxants. They have a characteristic chemical structure known as a diazepam ring fused with a benzene ring. The general chemical structure of benzodiazepine is as follows. In this structure, the carbon atoms are represented by C, nitrogen atom by N, and hydrogen atom by H. The numbers 1, 2, 3, 4, and 5 represent the position of the atoms in the ring system. Mechanism of action. Benzodiazepines brain mechanism. Mechanism of action. How do work benzodiazepine? Benzodiazepines are a class of psychoactive drugs that exert their effects primarily by targeting and modulating the gamma aminobutyric acid neurotransmitter brain in the neurotransmitter system in the brain. The mechanism of action of benzodiazepines involves enhancing the inhibitory effects of GABA by binding the specific sites on GABA receptors, which are ion channels composed of multiple subunits. Benzodiazepine pharmacological Benzodiazepine pharmacological observe metabolism and elimination. Benzodiazepine are a class of psychoactive drugs commonly used to treat anxiety disorders, insomnia, and muscle spasms. They work by enhancing the activity of a neurotransmitter called gamma aminobutyric acid GABA in the brain, leading to sedative, anxiolytic, anti-anxiety, and muscle relaxant effects. Absorption. Benzodiazepine can be administered through various routes, including oral, intravenous, intramuscular, and sub-illegal under the tongue. Oral administration is the most common route for most benzodiazepines. After oral gastration, they are absorbed from the gastrointestinal tract and enter the bloodstream. Metabolism. Once absorbed, benzodiazepine undergo metabolism in the liver. The primary metabolic pathway in hepatic oxidation primarily catalyzed by the cytochromes enzyme system. Specifically, the metabolisms of benzodiazepine produces active metabolites, which can contribute to the overall pharmacological effects. For example, diazepam is metabolized to its active metabolites, known as nordazepam. Elimination. The elimination of benzodiazepines primarily occurs through hepatic metabolisms and subsequent excretion in the urine. The metabolites of benzodiazepine, including active metabolites, are generally conjugated with chloric acid to form water-soluble compounds that can be eliminated. The half-life of benzodiazepines varies among different drugs within the class. Clinical uses of benzodiazepine. Anxiety disorders. Benzodiazepine are often prescribed to manage symptoms of generalized anxiety disorder, panic disorder, social anxiety or disorder, and specific phobias. They can help alleviate anxiety by promoting relaxation and reducing excessive worry. Insomnia. Benzodiazepine may be prescribed for short-term treatment of insomnia, particularly when it is causing significant distress or impairing daytime functioning. Alcohol withdrawal syndrome. Benzodiazepines are commonly used during alcohol detoxifications to manage the symptoms of alcohol withdrawal syndrome, muscle spasms, and specifically certain benzodiazepines like diazepam and clonazepam can be prescribed to relieve muscle spasms and spasticity associated with conditions like multiple cerebellum and spinal cord injuries. Adverse effects of benzodiazepine. Sedation. One of the primary side effects of benzodiazepine is sedation or drowsiness. This can affect a person's ability to concentrate, operate machinery, or drive a vehicles. Dependence and withdrawal syndrome. Benzodiazepines have the potential to cause physical and psychological dependence. Discontinuation or rapid dose reduction after prolonged use can lead to withdrawal syndrome, which may include symptoms such as anxiety, restlessness, irritability, insomnia. Cognitive impairment. Benzodiazepine can cause cognitive impairment, particularly in higher dose or in older adults. This can manifest as difficulties with memory, attention, and coordination. It's important to use benzodiazepine judicially, especially in older individuals or those with pre-existing cognitive impairments. Other side effects. Benzodiazepine may also cause other side effects such as dizziness, confusion, headache, gastrointestinal disturbance, and chances in libido. Benzodiazepine abuse and dependence. Epidemiological prevalence. Benzodiazepine abuse and dependence are significant public health concerns with the prevalence varying across different populations and countries. Age and gender. While benzodiazepine abuse can cause at any age, it tends to be more common among adults and the elders. Men and women are equally affected, although specific patterns may vary by age groups. Risk factor. Personal or family history of substance abuse. Individuals with a personal or family history of substance abuse are at a higher risk of developing benzodiazepine abuse or dependence. Polydrug use. Concurrent use of benzodiazepine with other substances such as alcohol or opioids increases the risk of dependence and overdose. Risk factors. Adverse life events. Chronic stress or significant life changes can contribute to the development of benzodiazepine abuse or dependence. Benzodiazepine overdose and toxicity. Benzodiazepine, a class of medication commonly used for their sedative, anxiolytics, anti-anxiety, hypnotic, sleep including and muscle relaxant properties. However, an overdose of benzodiazepine can lead to significant toxicity and potential life-threatening complications. It's important to note that the information providing here is not a substitute for professional medical advice. And if you or someone you know is experiencing a benzodiazepine overdose, symptoms of benzodiazepine: insomnia, difficulty falling asleep or staying sleep, irritability, easily becoming annoyed or agitated, in involuntary shaking or trembling of the hands or other parts of the body, sweating, excessive sweating, even when not exert physically effects or in warm environment, headache, persistent or recurring headaches, muscle pain and stiffness, muscular discomfort or tension, nausea and vomiting, feeling sick to the stomach and throwing up. Management and treatment. If a benzodiazepine overdose is suspected, it is critical to seek intermediate medical attention, call emergency services, or go to the nearest emergency room. Medical profession will take the following steps to manage and treat the overdose. Stabilization. The person's vital signs such as heart rate, blood pressure, and oxygen levels will be monitored and stabilized if necessary. Supportive care. Depending on the severity of symptoms, supportive care may include maintaining the person's airway, providing oxygen therapy, and administering fluids intravenously. Prevention of benzodiazepine. Follow prescribed dosage. Take benzodiazepine exactly as prescribed by your healthcare provider. Do not exceed the recommended dosage or frequency. Avoid combining with alcohol or other central nervous system depressants. The benzodiazepine should not be used in combination with alcohol or other sedative, as they can enhance the sedative effects and increase the risk of overdose. Regular medication reviews. Periodically review your medications with your healthcare provider. Inform them about all the medications, including over the counter drugs, herbal supplements, and any other substance you are taking. Current research or benzodiazepine. As an AI language model, my responses are based on information available up until September 2021, and I don't have real time access to the internet or the ability to browser current research articles or clinical trial database. Therefore, I cannot provide the information on the latest research of benzodiazepine new drugs on or ongoing clinical trials after September 2021. However, I can give you some general information about benzodiazepine and their research un- until my knowledge cut off. Benzodiazepine are a class of psychoactive drugs commonly used to treat conditions such as anxiety disorders and insomnia. Conclusion and future perspectives. Benzodiazepines have been widely used for several decades as an effective treatment for anxiety, insomnia, and muscle spasms. They work by enhancing the activity of a neurotransmitter called gamma aminobutyric acid (GABA) in the brain, leading to sedative, hypnotic, and muscle relaxant effects. While benzodiazepines have proven to be beneficial in managing various conditions, their long term use can lead to dependence, tolerance, and potential adverse effects. The role of benzodiazepine. Benzodiazepine are a class of psychoactive drugs that are primarily used for the sedative, hypnotic, and anxiolytic, anti-anxiety, muscle relaxant, and anticonvulsant properties. They work by enhancing the effects of a neurotransmitter called gamma aminobutyric acid GABA in the brain. Here are some common rules and uses of benzodiazepine. Anxiety disorders. Benzodiazepine are often prescribed for the treatment of generalized anxiety disorder, GAD, panic disorder, and social anxiety disorder. They can help reduce anxiety symptoms such as excessive worry, restlessness, and tension. Clinical practice. Indication. Benzodiazepine are prescribed for short-term management of anxiety, insomnia, and acute panic attacks. They may also be used as adjunct therapy for certain medical conditions such as muscle spasms. Duration of use. Medications, benzodiazepine are generally recommended for short-term use due to the risk of dependence and tolerance. Prolonged as use can lead to physical and psychological dependence, making it difficult to discontinue the medication. Public health awareness and education. Public health campaigns by play a critical role in raising awareness about the potential risks and benefits of benzodiazepine. Ed- Educating the general public healthcare providers and patients helps promote response use and reduce misuse. Prescription monitoring programs. Implementing can help track the pre of benzodiazepine, enabling healthcare professionals to identify patterns of overuse, prescribing practice, or potential diversion. Thank you from my side.